Hi guys, welcome to my YouTube channel. My name is Marlin. Before we start, I'll request that please subscribe, like and share and encourage me to do these YouTube videos more and more. So today I just wanted to talk and share with you about my educational life. First of all, I'm currently a nursing student in Kenya Medical Training School. I joined last year on March, but due to Corona, no, I joined 2020 March, but due to Corona, there was some delay, like you guys understood, and we stayed home for almost a year before we came back to school. I'd like to talk shortly about me and why I joined nursing. Probably you will be like, you want to join nursing and you want to know a few things about nursing before you join. First of all, you have to pass the minimum requirement for your grade. Mostly is in the portal. You have to, they check the cluster points in mostly biology, maths or physics or chemistry, English and Kiswahili. That's where they pay most of the attention. And then mostly in kmtc, the intakes for nursing are usually on March and September. When you are doing regular, that means you are a regular student. You have been called by the government, because KMTC is a school that it's a government school, so you pay a year fee of 80,700. But if you are the other student, you pay 120,000 for the whole year. Basically, KMTC in nursing school, there is 2 semesters, which is takes 6 months to complete, like 6 months one semester, another 6 months another semester, and that attains the 1 year in school. So let me just talk briefly on why I wanted to do nursing. First of all, nursing was not my first choice. I know. Before I joined nursing, I was a clinical medicine student, but not in KMTC. I was in a private school back in Kisumu. So I did clinical medicine for I think a year. Then there were issues with school and we had to drop out. The school was not certified, and the council closed up the school. So by the time they closed school to the time I joined nursing, I took a period of around 2 years, and I didn't really understand what I really wanted to do. I didn't know if I really wanted to continue doing clinical medicine or should I do nursing, because those were the 2 courses that I qualified to do. But then I figured that this is what I heard, that nursing is a job, is a career that you can't miss the job out. Like, it's when you're done with the course, it's so easy for you to get the job, which I'm yet to confirm. But I love the hospital environment and the fact that your presence in a patient life is really crucial. When I was joining, There's one of my friends who's a lecturer and also a doctor. He used to tell me, nursing is a bit now easy and simple because you've already done clinical medicine. Is a bit tough, more than nursing. So it's going to be an easy road for you because nursing is not that technical. That's according to my friend who's a lecturer. So when I joined nursing, I joined with the mind that this is a simple course. I'm just going to ride on it, like just a thing that I can handle. But then I came kupata kwa ground, like things are not the same. Nursing is a whole career, and it is time demanding. Like nursing, the moment you start nursing, like you are just running, like it's just a run. Like there's no, the time your break, like the longest break I've had is the August break that I think took 2 weeks before we resumed school. But all through the other break that was in March, it was I think from Thursday, we braked on Thursday and we were back to school on Monday. Nursing the classes starts by 8, sometimes 7:30, sometimes 7, and ends at 5. Sometimes it can even go until 7 p.m. Like it is very rare to have a free lesson. Like this is like, I don't have a lesson today. It is very difficult because the timetable is really packed. As a matter of fact, lecturers are fighting to get time because there's so much content that you have to know. Another thing with nursing is that it's time consuming. I said it takes you full time, and so the moment you're coming to do nursing, you should come with a mind that you will, your presence is required, like almost all the time your presence is required. Regarding the clinicals, so this is how the program works. You join. After joining, there's an orientation. Mostly the orientation takes up to 1 week because there's so much. You have to be shown your classes, you have to be shown your lecturers, you have to be shown the hospital, the environment, like the hostels. Like it's a long process that takes almost 1 week. After that, you embark to classes, and it's just, the journey starts immediately. So lecturers are from all over. Since I haven't seen with kmtc, I haven't seen problems with lecturers. They have been there, lessons have been attended. So you start classes at 8, you end at 5. So we did that for the first semester, though due to our course, with some of the theories we did online. So when we came back to school, we did an exam, an end semester exam, and then when we came back, we went to the hospital. Let me talk briefly about the exams. I think every student who's been through kmtc, like when you mention exam, this can rush, the blood rushes in your body. Guys, exams is everything, and there's this pass mark that you are required to attain so that you are able to move to another class. So the exams is a really big deal in school. It's a really big deal. In fact, during exam session in school, like you can just feel there's an exam coming. Like it is a serious thing. It's a very serious thing in school. And when the results are out, you have to attain the pass mark. If not, there are consequences. There's a supplementary, and then there's also a demotion, and that one happens. And any students in kmtc will tell you that is real. Like, it happens. People get supplementaries, people are demoted, like it is real. So exams is a big deal in school. So after that, when we did the exams, we went to our first clinical areas. This time it was not assessed because we were still on first year. So with the clinicals, we were trained. Personally, I was placed in MCH, mother-child clinic. There's so much that we learned there personally, because there's an immunization room where you learn how to immunize, the drug, the injection, the tox, everything. There's a room where there's a mother-child where they come, and then there's a lot of examination, and you examine. There's a lot of report you're giving. There's the family planning room where there's a lot of counseling, and then we offer the family planning services. There's a room that expected mothers come, history is taken, and then there's a clinical judgment on them, basically. So the other room is the examination room for expectant mothers. Basically what we do is physical examination, we take history, and then we give health education, and then we give the mother the report. The other room is the cancer room. There's a lot of screening and counseling also. And then the last room that I rotated was a wound cleaning room. There is just wound cleaning basically, and then referrals. There's another room that I didn't manage to rotate. That was the TB room. We didn't manage to go there. So that is basically what happens at MCH. That's what I did for my first year, second semester. So when we come back to school, there is 16 units that we are doing. I don't know, maybe I can mention them quick. This time the units we did in first year, we call it 1.1. first year, first semester, we don't do it in first year, second semester. We do different units, but they correlate. So there are 16 of them. After that, there's maybe I'll mention a few that will pop in my head so quickly. We do specialized procedure, fundamental in nursing 2. We do pharmacology, we do hematology, cardiovascular diseases. We do medical surgery in nursing. We do nutrition. We do pulmonary nursing. We do, there are 16 of them that we do, and there's an exam at the end of the semester. The 16 units, you have to do exams and get the minimum pass mark of 50%. So each and every unit you have to attain 50% men. Exams in kmtc is just like, you just have to be in kmtc to understand the exams there. So after that, you close for the year. That is when we closed for 2 weeks on August, and then we resume back on September. And on September, we started with the clinicals rotation. That's it for now. I hope this information is helpful to you. Thank you for watching. Thank you for listening. Please subscribe. Peace. Bye, guys.